Yes.
Oh, yes, I know.
Unreal. Oh, you need somebody up at the table here?
Well, I can sit up there.
Well, I'll get up there if you want a vision. I mean, you're gonna get a look, baby. Here I am. I got on a white shirt, so.
Hey, Jim.
You good? Now you can talk, big.
How are you? How are you? Hey, Ted.
Hey, how are you?
Hey, Bob.
You're getting me from my car this morning.
Perfect.
Okay.
All right, it's 9 o'clock.
Yep.
Jim, do you know if Susan is going to attend?
I can see anywhere.
What was that question?
Is Susan planning on attending?
I think Susan said she was going to. I think she said she was going to be away this week.
Okay. All right. Well, welcome everybody. Hopefully this will be the last time that at least I'm sitting here virtually. I spoke to Anne Marie a few minutes ago. I had another meeting scheduled this morning that actually was live and I didn't realize it. So hopefully we're kind of getting back to normal. I would like to introduce R.L. Hughes. R.L. is our new emergency management director at BB. Welcome, R.L. You certainly, you don't have to wear a tie for this meeting if you don't want to, but welcome.
I'm dressing up for you, Dr. Cowan.
Thanks. So RL is a name which most of us are familiar with. He has been involved in public service here in Delaware in the county for a long time. He was a major in the state police, his last position, and then he worked for the Department of Safety and Homeland Security for several years. And then most recently has been the chief of Georgetown. So I know his family very well because his daughter is one of my paramedics. So nice work with that, by the way. She's a very nice addition to the county. But welcome. We'll find a lot of work for you here, so thank you. So just as some administrative stuff, there's two sets of meeting minutes that we have. There are minutes from the January 4th meeting and the January 26th meeting. If we could make motions to get those approved.
I move that they be approved.
Is there a motion? Is there a second?
Second.
Is there any discussion? All in favor?
Aye.
All right. Perfect. Thank you. All right. So just regarding a COVID update, so it's largely good news. When we met last time, it was not good news. The number of cases in the county continues to decline. The number of hospitalizations decline. There's a bunch of metrics that you can follow. The metric that I follow most is the percent of positive cases. I think it's an easy number to interpret. Again, the goal is less than 5%. The CDC defines that as having, not excessive spread in the community. So we're currently at 9%. So still higher. The one thing that I'm a little surprised with is that we expected with the Omicron variant to have the tail end of the surge be much steeper than what it is. So it's been a little bit of a surprise. It's certainly going down. It's certainly good news. No reason for concern, but I thought we would be closer to the 5% by now. It's kind of interesting. The question is whether or not the BA2 variant of Omicron, if that is sort of keeping the virus in the community a little bit longer than what we expected. The good news is regarding BA2 is that it is, although it's more infectious than the original, the BA1 Omicron variant, it is not anymore, doesn't create any more severe illness. So hopefully it's not thought currently by the World Health Organization to create another spike, but just sort of create a little longer tail to this Omicron surge, much like we saw with the other surges. But we clearly are heading the right direction. That should be the overwhelming message. Hospitalizations in the county are down. To give you a perspective, currently in the county, there are 22 people that are hospitalized with COVID. That number was 90 February 1st. So we're headed in the correct direction. The chief operating officer at BB, Rick Schaffner, we had a conversation a week or two ago, and he pointed out that the number is a little misleading, though, because from a hospitalization standpoint, after 10 days from your positive test, we consider you clear of the virus, but you still could be hospitalized. So you fall off our COVID numbers, but you still could be admitted to the hospital. So we do have a fair amount of people in the hospital that are suffering from the complications of COVID, but technically are COVID recovered. So, but clearly overall, great news that if we're at 22 today, or as of yesterday's data, and we were at 90 a month ago. So clearly headed in the correct direction. So the vaccination data is really the same. The disappointing thing with that is, in my opinion, at this point, we should really be looking at third shot data, not considering people fully vaccinated with 2. And if you look at the third shot data here in the county, for all comers, it's just 33.4%. Now, if you look at people over 5, which is the real number, it's still only 35%. It's really a low number. If you look at the people over 65, where it's most important, that still number is 71%. You know, if you look at that over 65 number, 96.5% of the people in the county got vaccinated with 2 doses, but only 71 have gotten a 3rd dose. So there is no doubt that there's an opportunity going forward. But, you know, I think from a city of Lewes standpoint, I'm not sure much we can do about other than using these public forums to encourage people to continue to get vaccinated. Sadly, COVID's not going away. It's just something we're going to have to learn to live with. And the combination of vaccination and immunity from native infection is going to be how we kind of beat this down. We know that if you are infected with COVID, we believe you have about 90 days of pretty good immunity, but certainly much longer with a vaccination. So even people, what I've been encouraging people that are not vaccinated is that once they are clinically well, it's a benefit to them to go ahead and get vaccinated. I don't know if that's made a difference or not, but that's kind of what I've been preaching to everybody that I could see. So,
Paul, I've been hearing that people are observing that idea of getting their vaccination if they haven't been. So, the other question I have is now some of the pharmacies in Lewes are offering the 4th booster or the 2nd booster. Is that something you're keeping track of at all?
Right. So if you look at the state data, they're not keeping track of that at all.
Okay.
So,
I know there's a controversy about it, but I do know several people in the Lewes community who have gotten their 2nd booster.
yeah, I think that's going to be a public health question going forward over the next several months, really beginning at the national level, whether a 4th dose is recommended or not. They've done a 4th dose in Israel. I haven't seen any data with regards to that. But you know, this is a ever evolving process. We know more than we did a year ago, but it's a new disease.
Right.
So kind of learning more on the fly.
Right. And that will continue, I'm sure. So.
Yeah, but overall, good news in the community with regards to COVID. That should be the take-home message.
Sure.
Yeah. Bob, how are you making out in the schools?
We're doing well. As reflective in the county and the zip codes that make up our district, we're seeing the numbers substantially lower than they were even a few months ago, and the number of cases have decreased almost like each week. They're cut in half each week, which has made a big impact on not just kids being in school, staff being in school, but just other staff that we have that have to kind of keep up with all the data tracking, contact tracing. It really has made a big difference in kind of relieving some of that stress and the issues that go sort of along with those processes. So now, obviously, with the governor's announcement about the end of March, we're now kind of finalizing how things are going to be looking with contact tracing and with quarantines. And at our March 10th school board meeting, we're going to be kind of bringing this up as a topic and making decisions how we're going to move forward beyond, the end of March, going April, and hopefully for the rest of the year. Obviously, whatever we do decide will be dependent upon, what happens down the road, but we're hopeful and crossing our fingers that things remain fairly quiet and the numbers stay low so we can continue to kind of have some kind of normalcy for the rest of the school year.
Yeah.
So March 11th is Thursday, which is our first meeting in March. I really didn't want to wait until the last meeting in March to make the decision. I felt that, I didn't want to make it too early because numbers could change, and then you're kind of reversing things. But I think March 11th is enough time we can answer questions and make sure everything's in place to kind of move forward after the end of March, and we'll see where that goes. My goal is to have opportunities for us to, have, masking as, something that's, recommended for people, but we're still working out the details of what that's going to look like with contact tracing, those kind of things before we finalize. But, as long as we can do it safely, I'm definitely, that's my thought.
Good. I think if the data trends like it is, that will kind of support your position. So hopefully.
Yeah, and first, any decision we've made here, even going back, when we had, elementary kids in 5 days or whatever the decision was, it was, the primary decision was about the kids and creating a learning environment for the kids that's the best that we can for them. And I think of some of our, elementary, middle school, and even high school students who haven't had that experience. Some kids are getting ready to graduate and have had, almost 2 years of their high school career with, the high school, experience with masking and with dances, with graduations, all those kind of things, so really would like to have, especially for the kids, some type of normalcy done safely for them.
Sure. No, that's been a struggle. There's no doubt. Good. Thanks. So the one thing I did mention about the hospital, and then I'll go turn over to RL, but not throw him under the bus. We, in the beginning of February, we limited our surgeries based on the volume of COVID we had in the building. And then we have slowly been increasing our surgical services back in as sort of beds allow. As of today, we've actually returned to normal surgical services. So we are kind of back to normal, which is good. It's, the trouble when we, as an organization, when we delay what we call elective surgeries is, elective is in the eye of the beholder. Everybody who needs surgery needs to have it. And we know that those people become urgent the longer you wait. So we learned that from one of the earlier phases of COVID, one of the earlier surges. So we were quick to get back to doing surgeries. We actually continued all of our oncologic surgery and surveillance during that time, just because it's such a critical thing to do, and time really does matter in that case. So, Ariel, do you have anything else that with regards to the hospital and COVID right now?
Well, Dr. Count, as you know, and I'm not sure if this group is aware that we are operating under what's called a HICS level 1 standby. That means that from an incident command piece, certainly through the surge through January and through this month thus far, it did require some additional leadership pieces to be put into place and some restrictions. The good news is we are down to a standby level, meaning that we meet once a month or once a week. And I'm hopeful that will soon very much change. Maybe even so much today, it may change, but because the numbers have gone down. But Dr. Count, I do appreciate the invite to this meeting, and to the rest of the group, I am still on my listening tour. So I will listen twice as much as I talk and just stop there.
Perfect. It's, yeah, you're a big addition to BB, and the former emergency management director is, she's the one that got me involved in this committee, and this certainly has been, it's been helpful for me professionally to be part of this committee. So thanks.
Thank you. Yeah, I'd just like to call to RL's attention that we are going to be doing a tabletop exercise of having to do with a table evaluation of our emergency operations plan on the 23rd of March. I hope you'll be able to participate in that. It will be out at the Denrec building at the end of Pilot Town Road.
Thank you, Mr. Mayor. I would love to participate in it. Whom should I contact to give myself an invite?
Yeah, I thought Chatham Marsh had already sent you an invitation, but if he hasn't, we'll get you one.
Okay, thank you, sir.
Yeah, thank you.
Ted, what's that tabletop all about?
Actually, it's going to be the topic will be largely a hurricane that would strike the coast of just off of Lewes, and what we would have afterwards, how we would react to that.
Okay.
It's estimated to be a 9 to 2 exercise, and it'll be our whole team of emergency operations.
And you said it's March 23rd?
Yeah, a month from today.
Okay. Good.
Well, I just read the other day that there's been a new variant that come to light in New Jersey. I don't recall the name of the variant, but are you aware of any in Delaware, a new variant of the virus?
Yeah, I think what you're referring to is the BA2 variant of Omicron. That is, remember with this virus, there are literally hundreds of variants that they see. But the BA2 variant of Omicron is what the most common other than BA1 that we're seeing right now, and it's not common. So currently in the state, we think that the BA2 variant represents somewhere between 6 and 8% of the samples that are tested. And again, remember, not every positive COVID test is sampled, but a statistically significant number is. So I think that's what you're referring to. And the good news is that, again, it is more infectious than the BA1 variant. But it is not any more, the illness is not any more severe. So essentially it is behaving from a public health standpoint just like the BA1 variant, which is good. We weren't sure of that a couple of weeks ago, but that is kind of how it's sort of playing out. And again, with this Omicron variant, we've been looking closely really at South Africa, which is where it was first identified. But again, it may delay the complete normalcy after the Omicron variant, much like we saw with the other waves. But it should not significantly change things, at least at this point. Okay. Anne Marie, are there any hands up or anything?
No, I don't see any hands up on the screen, so I think we're good.
Okay. Is there anything else that anybody has questions about, or anything that I didn't think to mention?
Hi, Dr. Cowan, it's Patty.
Hi, Patty.
I just have a question for you. There's been a lot of discussion about mask wearing in different organizations and things. I was wondering, is the hospital and doctors' offices anywhere near removing the mask mandates?
So the doctors' offices, if they're independent doctors, that's their own decision. Outside of the masking mandate from the governor. And I will thank the governor for that, because that masking mandate was really at the request of the healthcare organizations as we were getting crushed with volume. So the healthcare organizations will take some responsibility for masking over the last 2 months. I think from the organizations, we will continue to mask. I don't see it ending anytime soon. I think what we may see at some point is that patients and visitors stop masking. I imagine it'll be a long time before the staff itself stops masking. So, but nothing in the short term changing that, unfortunately.
Thank you.
Yeah, it's unfortunate. We recognize the biggest hurdle in healthcare with masking is the communication aspect. if you can't look at somebody else's entire face, you can't, so much of our communication is nonverbal. I find myself now taking my mask off sometimes to have critical conversations with people just because I need to see my face. Hopefully we'll get there. I think we're all tired of it. What's funny is when this first started, the back of my ears would get red and blister from wearing a mask all the time. And I noticed several months ago that I don't even feel it anymore. I can wear a mask for an entire shift and it doesn't bother me anymore. So I guess I've gotten toughened up.
Well, for some of us old guys, the over the ear things get tied up in your hearing aids.
Right. That's a good point. All right. So if there's nothing else, I guess, Mr. Mayor, how far out do you want to go for another meeting?
I think we could probably go 2 months on this one. So
Okay.
we're looking at the end of April, early April or mid-April. How does that sound to you, Paul?
That's good for me.
Okay.
How about, is Tuesday the 19th? Does that fit in people's schedule?
That could work.
That could work. Yep, we're good.
RL?
Yep. That'll
Okay.
work.
So,
9 a.m.
yeah.
9 a.m. the 19th. That seems to work for everybody doing it early.
Yep.
Okay.
And we have gone back to in-person, and my assumption is that by that point in time, the state of emergency will be lifted, so we will need at least one member of the board to be in
Yeah.
City Hall.
Yeah.
I should be able to be, and hopefully Paul can.
Yeah, I'll definitely be there.
Okay?
But one of the great things about Zoom is the efficiency of it, both for Bob and RL, that they can pop in and get back to everything else that's going on. So I think we'll continue that, and it makes it easier for people, but I certainly will be there.
I think we're going to continue both virtual and the option for now.
Yeah. Okay, very good.
All right.
Thank you, everyone.
Thank
Thank you
you.
very much.
All right.
Have a good day.
See you.
Thanks. Bye-bye.
Record